Welcome back, everybody. I've got a very prominent man, Dr. Mark Bowes. We were joined with Mrs. Bowes earlier on, and now we've got the doctor, the dentist himself, right? How are you? How are you feeling?
I am feeling wonderful. I have to say that one of the things I love is sharing my experience as a dentist with other dentists, you know, and that's what we're doing today. So, yeah, I hope everyone enjoyed it. And you know, I think information or education, I think education in the world is what really allows us to develop as human beings. And so in dentistry, there's nothing different.
Definitely.
And I really value the responsibility I have to share my information. Yeah.
Please do tell us, just to touch on very quickly, what you presented about today, to give viewers a quick understanding of what was happening.
So today I presented on the evolution that's changed the face and the landscape of dentistry, which is the digital era. You know, I think actually if you look at the world, everything has changed, in my opinion, for the better. But dentistry wasn't left behind, and the digital tools that we have as dentists have allowed us to become more precise, more predictable, to be available at all levels, because the technology has allowed complex situations to become more simplified. So, you know, I think that it's a really good thing for dentists, but most importantly for the patients, you know, because that's where the benefit ultimately lies in our profession. You know, at the end, it's the patients that we have to look after.
Definitely. So now, when you guys introduced technology to dentists, how was their initial reaction to this? How was them using it now, you know, implementing it in their daily dental practices? How did it go?
To the patients or the dentists?
The dentists.
The dentists.
Yeah.
I think the problem with dentists is that, you know, obviously a lot of the education is sadly not, and I think this is across the whole world, where it's impossible to embrace these new technologies at an undergraduate level because the universities can't keep track with the progress of digital. So there's a little bit of a gap, and that's where we fit in. I think that the differential between dentists is quite clear, that the younger dentists, they love digital. You know, that's the era that they were brought up in. And the older dentists are more hesitant to want to change, you know. So, but the reality is our world is changing, and it won't be up to us to make that decision. We will have to go on this journey. Otherwise, we will be left behind.
As well, in your presentation, you showed us, you know, like 3D models of, you know, what is done. Is it prior, the whole, you know, checkup, extraction of teeth and everything? It's what's done before that, right? Could you please just touch on that and explain to us?
So, like, again, one of the problems we had in our profession was the ability to communicate what it was that we were wanting to do for our patients to help them, because we didn't have the tools, you know, and today we would have to just explain it to them in the best way we could. But a technical explanation of treatment is very difficult versus an explanation where the patient can see it on the screen. So they can visually see the process that they need to go through before we start any dentistry. And this is really powerful. You know, I mean, the way I put it, if you want to put it into terms that maybe patients will understand, is that, you know, can you imagine the era where architects were designing houses and the only thing you saw was a piece of paper with lines, versus today when your architect does the plans, he creates a 3D model of the house.
Very complicated.
That you can walk through the whole house.
And
you can even change the color of the curtains and the sofas before you decide to go ahead and build a house. This is the same for us. We have this power of being able to visually let the patient understand first the problems. We can present the solutions, and they can make a really much better decision about the treatment that they want. Yeah.
So in terms of like finances, if somebody has a clinical practice, right, in terms of finances, as in, I would like to call you an expert because I know nothing. So anybody who speaks about dentistry is an expert to me, right? So how much would you say in terms of finances should one, put aside for, these machinery and all these kind of things? Would you have an idea?
Yeah, and again, I think if you go back in technology, I remember that the first mobile or cell phone that I bought for my wife was like a backpack, and it cost a fortune. Whereas today we can buy cell phones for a lot less. And this is the same in dentistry. That 5 years ago it was really expensive, but as the technology evolves, more companies come into the market, and the price is coming down. But not only just the price, but the quality as well. So, I think that again, it's about how accurate and what can it do for me, and how much will it cost. And I think these questions have been answered in terms of that it will do a lot for your practice, for your patients, but also that slowly but surely the costs are coming down because of the competition in our industry. And I think that also that we can't exclude the countries that are not just first world countries. I think that this is an important responsibility that a lot of the companies also understand, that they're trying to make sure that it's available to countries that can't quite afford what other countries can.
Okay, so you also mentioned, is it, can I get the name right? Is it Implant and Aesthetic Academy?
That's correct, Implant and Aesthetic Academy.
Please tell us about that.
So the Implant and Aesthetic Academy is actually in our practice. So we have an in-house training center that we run courses throughout the whole year. I'm running the restorative, which is the fixing of teeth part of it, not the surgical side. I have a partner of mine is a professor of periodontal dentistry, and he's running the surgical side. So I'm the guy fixing the teeth above the gum. And we have programs that we have set up for dentists to enhance their careers, from single programs to actually diplomas that they follow through 7 modules over a year or 2 years and end up with a diploma that allows them, and I think one of the difficulties as a dentist is the anxiety of having the confidence to treat our patients in the best way, and so what we do is we give them these tools that they need to allow them to go into to practice more comprehensive dentistry, but in a way where they feel really comfortable about the assessment of the case and the outcome.
Do we have that? Are you guys here in Botswana? Do you guys plan on coming to Botswana maybe to,
Do you know that last year was the year I thought about, and this again is maybe for next year, is about making these programs available partly online, but partly at our training center. So what that does is means instead of having to fly to Cape Town 7 times, which is not a bad thing, by the way, it allows the dentists in more remote places to do most of the training, the theoretical training at home, and then they come to Cape Town just for one visit to do all the practical training. So they can get the value of the diploma in a much more economical way because of the time commitments and the travel commitments. So yeah, in a way we will be coming to Botswana.
Okay, would you say, just for advice, would it be more, let me say cheaper, I don't know, to implement this with government or, private clinics?
I think we had a nice discussion earlier on about, that dentistry, like for many, many years, was really an exclusive profession because it was driven by processes that required the highest skills from technicians, and the costs were prohibitive for really, I would say, most of the world. Whereas the digital technologies that have come have allowed these treatments to become more affordable, but more available from a location point of view, because a lot of the planning and what we're doing can be done remotely in different places. So, yeah, I think this has really changed everything for us. So, yeah, I think that's the answer.
Thank you so much, Doctor.
That's right.
Thank you so much for joining me.
That's my pleasure.
And I hope I see you again next year if we're going to have something like this next year. But then we're going to be coming now with solutions for my country.
Solutions.
So we can, digitalize almost everything actually
These are solutions for the world.
For the world.
They're not for Cape Town. They're not for Botswana. They're for the world. Because the world needs dentistry, period. And it's up to us to find solutions for dentistry for everyone, everywhere. Yeah.
Definitely.
100%.
Thank you so much
That's
for
right.
joining me.
My pleasure. All righty.